In this video, we'll present the nuances of a petrosal sinus sampling on a 67-year-old female with signs, symptoms, and possible Cushing's disease from a small pituitary microadenoma. The patient was referred to us for petrosal sinus sampling. Some of the important neuroanatomy or vascular anatomy is internal jugular vein, the cavernous sinus, the inferior petrosal sinus, and the pituitary veins that connect both cavernous sinus. As an interventionalist, we have to be very familiar and identify all this in a venogram. Here you can observe the internal jugular vein, the cavernous sinus on both sides, where the pituitary is, the inferior petrosal sinus, the basilar venous plexuses, and the circular sinuses around the pituitary gland. We first obtain access into the femoral vein with a 6 French sheet. We navigate a diagnostic catheter, it could be a 5 or 6 French angle catheter, and we obtain the similar access on the other femoral vein. So we actually have 2 catheters, one on each petrosal sinus. We then go into the right inferior jugular vein, and then from there into the inferior petrosal sinus. We always do continuous venograms to make sure that the integrity of the venous system and there is adequate space for the microcatheter to go into the inferior petrosal sinus. At times, the petrosal sinus is just a network of capillaries that doesn't allow a microcatheter to go into where we need it to go. In this case, the patient has very good anatomy, and we are able to navigate the microcatheters, as you can see they're pointed by the arrow where it needed to be. It is important to mention that systemic heparin was administered to obtain a ACT more than 250. Simultaneous sampling is performed according to the following protocol. We obtain a 5-minute sample and 1-minute sample prior to CRH stimulation or administration of the medication. And then once we administer, we obtain simultaneous sampling from both microcatheters at 2 minutes, 5 minutes, and 10 minutes after the CRH stimulation. Simultaneously, we are obtaining samples from a peripheral vein at 30 minutes, 45 minutes, and 60 minutes after the CRH stimulation. Always keep in mind that before each sample is drawn, the catheter have to be aspirated, and all this saline diluted blood should be thrown away. Once all the samples are obtained, a venogram is performed before removing the microcatheters, just to rule out or exclude any iatrogenic injury to the veins or the sinuses. And then finally, once all the samples are obtained, we remove all the catheters, including the femoral sheath from both sides, and we close the femoral veins, punctures with manual pressure for about 10 minutes. Remember that the percutaneous closure device, such as MINX or Angiosil, are not indicated for femoral vein closure. The patient is observed under strict bed rest for about 4 hours after being discharged. The patient can be discharged home the same day of the procedure. Thank you.